Well, cellulite is one of the biggest cosmetic complaints from women. Many products and procedures are available, though, to lessen that dimpling of the skin, but many say nothing really works.
A new FDA-approved procedure is promising, though. I found a plastic surgeon here locally who's performing it at Renew Body Sculpting. Take a look. Our viewer Krista tells me she has tried everything to get rid of cellulite. So far, nothing has worked, not even surgery for it. So she wants to know what else she can do. If there's anything new going on. She's already tried lipo, it didn't work.
Well, what can happen sometimes with people with cellulite, they'll have a couple of different spots that are just really troublesome. And these spots are going to be where there's attachments of the skin down deep. And that's what really causes the cellulite and the dimpling.
So what do you do?
Well, if you have dimpling, say, for example, like this, where there's a spot, and you may have one or more areas like that, what we can do is combine intervention with what we call releasing the cellulite bands. And we do that with a device here at Renew that can be done under local anesthesia. You can see the device here is a cannula with a V dissector tip. And what we do is we would insert that underneath the skin to basically divide those bands that are holding the skin down. But you combine that with some of our other cellulite treatments, such as CoolSculpting, and you can really get rid of these areas and make them look better.
Now, when I take a look at this, I mean, this is fairly small, but everywhere you have one of those cellulite pockets, so to speak, are you going to have a tiny scar that big?
No, basically these devices are inserted via an incision made by a needle, and that needle incision will not cause any scarring. On the inside, the division along with the reduction of fat around the banding should reduce the appearance of the dimpling and make it look better.
Is this something that you can stay awake if you're the patient, or are you going to put them to sleep?
Absolutely. This is something where we do just local anesthesia. We just inject around there, and it should be something that shouldn't cause any pain.
It sounds like if you're clipping those bands, you would see pretty quick results.
Absolutely. What we want is immediate results, and we combine that with our other treatments, and those two things together should make things look a lot better.
You know, everyone's going to ask me how much it costs.
Of course. Our treatments, and it depends on the severity and the number of sites that we have to work on, but it could be anywhere between $200, $600, just depending on the severity.
Well, you have tried all kinds of surgery with your patients. How do you feel about it as a doctor? Do you think this is very promising finally, because it seems like things just have not worked in the past?
Well, with liposuction, it's not always an exact science. You can get pockets, and sometimes if liposuction is done too closely to the skin, you can get dimpling like this. And basically combining this treatment along with other cellulite or fat reducing treatments, that does make those areas look a little quite a bit flatter and adjust some of the liposuction inaccuracies.
Well, hopefully it's the relief that our viewers are looking for. Thanks for your help.
No problem.
If you have a question you want me to ask the doctor, you can find me on Facebook, or all you have to do is search Melissa Wilson Fox 26. On Twitter, it's Melissa Fox 26.